The number of coronavirus cases is still soaring across the globe. And right now, separating fact from fiction is more important than ever. Tonight, we've assembled a panel of medical experts to talk straight to you, Central Florida. You're watching an Eyewitness News special, Coronavirus Pandemic. Your questions answered.
We are going to spend the next hour working to answer as many of your questions as we can. Good evening and thanks for joining us. I'm Vanessa Eccles.
And I'm Greg Wormuth. First things first, we have some social distancing here, 6 feet apart. Let's introduce you also to our panel of experts who you'll be hearing from, and they are at Advent Health. Again, that 6 feet rule we're all following. Dr. Timothy Hendricks in the middle. He is the medical director of Advent Health Centric Care. Hi, Timothy. Dr. Hendricks. He's going to walk us through signs and symptoms as well as prevention and testing.
Dr. Peter Schuck is the Senior Vice President for Population Health at Advent Health. He'll focus on questions about work, social distancing, and keeping the community safe. He is on the right of your screen there.
And Dr. Luis Allen is a board-certified psychiatrist and medical director at Advent Health Center for Behavioral Health. He'll dig into the psychological effects of coronavirus, the anxiety surrounding it. Many of us are feeling that, and how to stay mentally healthy during what's going to be a long stretch, more than likely.
And so we know so many of you have questions. Here's how you can send them to us on social media. Go to the WFTV Channel 9 Facebook page. You can tweet us at WFTV, or you can post on our Instagram page, WFTV9. Now, Advent Health also activated its own hotline staff with medical experts to answer your questions as well. The number to call is 1-877 Virus HQ. It's also up on your screen. You see it right there. The information line is available 24 hours a day, 7 days a week.
And here's the most up-to-date information for you on the virus in Florida, straight from the Department of Health just moments ago. There are 328 Florida cases of COVID-19. 14 of those are new since this morning. 40 are in Central Florida. And there's a county-by-county breakdown on your screen as well right now. Now, what's changed since we last saw you at 6 o'clock tonight? 2 new cases in Orange County and 1 new case in Brevard County. The number of deaths has also risen now to 8. The overall case number will likely expand soon as well, now that the state is building a testing site in Orange County.
There's going to be a regional site at the convention center that we probably will be operational in the next 48 hours. We are waiting for information. As we speak, all the deliverables are getting into place, and it's going to be managed by the National Guard, and I'm pretty sure that we will play a support role in those efforts.
We'll have a lot more on the local impact of COVID-19 coming up on Eyewitness News at 10 and 11, but right now we want to focus on you and the questions that you have. You know, we're taking in so much information, Vanessa. We're also generating a lot of questions as we go through and navigate through this.
And that's why we're here to do that tonight. So let's get to that first question, which is, where can I be tested? So Dr. Hendricks, if you will take that one. So many people are asking that. They feel like they want to get the test, so where do they go? What do they do?
Well, first of all, we have to understand that testing is mainly for those people that have symptoms. We're not testing people that are concerned about contact or exposure in our community, because our priority is to test those that have symptoms and those that have risk factors. For instance, travel, contact with a community where there's a higher risk of a coronavirus, et cetera. So we are doing testing at Centric Care, but again, on that limited basis, based on those criteria.
Dr. Hendricks, I have to have a follow-up question as it relates to that with you. We see people that were otherwise perfectly healthy, maybe a basketball player, get tested, the test comes back. Why is there this disproportionate testing happening where folks who appear to have more money than others are being tested? Can you answer that?
That's a good question. I agree with you that there are people getting tested that really don't need to be tested. And so we're hearing about that, and it's going contradictory to our CDC guidelines and standards. So the community thinks that, well, I can get tested, these other people are getting tested, and it's just not medically justified. But I'm not going to make judgments of another doctor's practice where they might be doing those tests.
All right, so let's get down to the bottom line. Can I get a coronavirus test at Advent Health? That came in from one of our Facebook followers, Dr. Hendricks.
Yes, you can, but again, based on those criteria. So at Advent Health, our facilities all have the test available. We have a commercially available test at our hospital, and we're sending out to reference labs for our ambulatory center. Now, we started testing last Friday at CentraCare and offering that to our patients, the patients that are at risk, and we found that there has been a little bit of a delay in getting those results back. So it's about a 5 to 7 day turnaround time to get those results in an ambulatory setting. Our hospital has priority, so if we have patients that are in the hospital and are in the ICU, we need to know right away, we can get those tests a lot faster. So there's a little bit of a difference there, and that's why I want to emphasize that we only want to be testing those that absolutely need it and prioritize those people. I know people think, I want the test, why can't I get the test, why isn't the test available? Well, from a medical standpoint, it's pointless to get a test if you don't have symptoms, because it won't detect the virus until you start having symptoms.
And Dr. Hendricks, to follow up with that, we have this question from social media as well. The person says, I have symptoms, should I be tested? So is this a case of maybe someone thinks they have symptoms and they might not? So talk about that issue for us, please.
Well, that's where this type of setting here we have here with 877 Virus HQ. We've set up this type of call center where you can get information. If you have those questions, if you can call your doctor and talk to your doctor, because it's not just a matter of having a cough, a runny nose, or a fever. We are still seeing a lot of people in Central Florida with type A flu. So influenza is still going around. We still have a very active flu season. And in fact, when the most people come into CentraCare and want to be tested because they have a fever, they in fact have the flu. And so it's we're also seeing upper respiratory viruses. We're getting into allergy season, so we're seeing a lot of sneezes and itchy noses. And so a lot of that's just helping people sort out if they really need a test or not, if they have symptoms and have those risk factors.
The cost of the test, what if I can't afford that test, was that question that we popped up on the screen. Dr. Hendricks, is there a simple answer to that?
No, unfortunately not. It depends on your insurance, it depends on your plan, and of course the hospital and CentraCare, we can discuss if you're self-pay, what payment options are available in terms of the cost of the test. So it depends on the lab also. Even within our own system, Quest and LabCorp and Advent Health, there are different prices depending on the test. You're typically talking a test that's going to run at a minimum $150. I've heard some states, there are pharmacies offering it self-price at $300. So it's just all over the board, and this is such a fast-moving type of outbreak, so to speak, that we've got to test, and nothing has really been standardized yet.
There is some good news as it relates to that, Dr. Hendricks. Late today, the Senate bill did pass, and so that will pay for the testing for folks, so they don't want money to become a big issue there. We're going to continue with our questions. Also, we're going to bring in our radio partners at News 96.5 WDBO. They're taking your questions over the air, and they're bringing them to us. Let's check in with our Joe Kelly. Joe?
Hey, Greg, I've got a lot of questions that are coming in, and you can call us at 844-220-0965. If you have any kind of question, you can also text us to the number 21232. We just heard from Keith in Lake County, and Keith has an interesting question. He asks, is it safe to be traveling by car right now? And if so, what precautions should be taken?
That might be a good question there for Dr. Shuck, maybe?
Oh, that's for me.
Or Dr. Hendricks?
Dr. Shuck, you want to take that one?
Yeah, I'm happy to take that. I don't think so. I think most of the precautions have been related to mass transit in things like airplanes, trains, et cetera, where there is very close contact with large numbers of people. We talk about social distancing, and we're practicing the 6 foot distance between the guests here in the studio. We want to make sure that we're practicing social distancing even when we travel as best we can. Traveling in a car with known family members without symptoms to a place where you know you're going to be isolated, I don't think we have any recommendations against that. Certainly traveling to areas where the virus is known to be present, we would advise against that, as would the CDC and the Department of Health.
And I would imagine that at that point we just wash our hands after, filling up the gas tank or something like that to make sure that our hands are clean for something like that.
Absolutely right. I think the same things that prevent the spread of disease, such as influenza, will help to prevent the spread of COVID-19 as well. Good hand washing technique, hand sanitizer, if you have it available, would be good to use. Again, the social distancing. Don't touch your face frequently because that way things don't get onto your mucous membranes. And making sure that if you're coughing or sneezing, you are certainly covering your mouth or turning away from anyone near you.
Joe, anything else?
I've got a question from Ronald in Kissimmee. Yeah, Ronald in Kissimmee has a great question, and he asks about, he says he's a small business owner. When will he know that his employees can come back to work?
Yeah, that is an incredibly difficult question, and I know the employers are struggling with that across the country, to be frank. Generally speaking, we are not testing folks to determine they are negative with the coronavirus to clear them to come back to work. Generally, we are recommending, in the same way we do with influenza or other outbreaks, that when you are symptom-free for a 24 or 48-hour period of time, it would be safe to return to work in those spaces.
All right, Joe and Peter, thank you very much. We're going to talk also about the anxiety levels that all of us are feeling. You know, we might have the physical symptoms, but what about the mental symptoms? And we have an expert for that as well.
That's a very important component in all of this. Stay with us. We'll answer more of your questions right after the break.
Welcome back. You know, we get emails, we get texts, we get hit up on social media with people's questions. And now is their chance to have their questions that they're thinking of answered directly by the doctors.
Exactly. Let's jump right in now with more of the questions. And we had one: how do I explain to my elementary school child they will not be seeing their teachers and friends for a few weeks? And I want to get Dr. Allen to address that. Talking with the kids.
Well, we have to make sure that we are letting them understand some of the aspects of what we're dealing with, but clearly the level of detail and the amount of information that is being provided out there is too much, and sometimes we become very overwhelming. So yes, we have to tell them about that there is a virus, that this is contagious, and why we are isolating from others. And I think the easier the language that we utilize with them, the more the reassurance that we can provide them as you're explaining this and letting them know that it will have an end, that it's not the impending doom that at times as adults we might experience. That becomes very reassuring for them.
It's kind of hard to imagine that it was 1 week ago today, Doctor, that we found out the NBA was canceling games, and look at how much has happened to all of our lives. It's impacting every single one of us, and people are having a difficult time controlling their anxiety. They're anxious, they're losing sleep, and that's impacting everybody. And that's not just about the spread of the disease, but also the possibility of losing their job, etc. How can someone best control their anxiety? Is there a simple way of helping all of us?
This has become, and you're right, in less than a week has become our new normal. And at this time, there are some very basic things that we should follow in regards to how to keep our health and our mental health in check. And one of them, and I know it might sound very simple, but is trying to keep regular sleeping hours, making sure that we are getting those hours in. It's very important that we also eat in a very healthy way at this point. One aspect that is very tempting at times in periods of isolation or boredom, or when someone is experiencing decline in their mood, is to try to rely on substances like alcohol. And that definitely will make things worse. So we don't recommend the use of any type of alcohol or high stimulants for that matter.
And Dr. Allen, also, I want to ask something that we've talked about here in the newsroom and among friends and family. With so many people working at home and this whole social distancing, how do we make sure that this does not become like isolationism, if that's such a word, in terms of just keeping in touch with people even though we might not be seeing them?
Yes, we are in this current new normal we are at high risk for this to happen. And that's one of the reasons why it is very important. And in particular, my background is geriatric psychiatry, that with our seniors, we reach out to them because often their lives are pretty isolated at times, and now in this time it's even more. So it's important for us to, if you have a friend, a family member, or someone that is a senior citizen, to try to reach out to them and just find out how they're doing. That phone contact, hearing your voice, probably will make a big difference. In regards to for the rest of us is yes, we have to reach out to someone, keep those daily contact, keep it as a routine, because given that we are dealing with this for the long haul, it will be there for weeks to come, and we know that more than 10 days of dealing with some of these aspects, the level of anxiety can increase even more. We have to make sure that we're taking all of these healthy measures at this moment, which we're probably at day 6 or 7.
All right, Dr. Allen, let's move over to Dr. Shuck. And I have a question here that really is near and dear to my heart. It was asked by someone again on social media, and here it is. What if seniors can no longer take part in normal social activities and depression or anxiety sets in? I know that, for example, my father, who has dementia, is now in isolation. No one can go and visit him in terms of friends and family. What do you recommend for us as we're worried about it, and how do we best deal with this?
Yeah, no, I think it's a great question, and one that's near and dear to my heart as well. I have an 85-year-old father who lives in the Midwest by himself, lost his spouse 3 years ago, and to the points of social isolation, certainly keeping in contact with him intentionally much more frequently, perhaps, than I would on a normal basis, both through phone calls and also through video chats and FaceTime, those kinds of things. We live in a time where we benefit from some of those technologies that many of us can use in those spaces. For those that are confused and isolated at home, I don't know as social isolation needs to be taken so far that appropriate caregivers wearing the appropriate or taking the appropriate precautions that are asymptomatic can't be near them. And I think that's something that's important, that we don't go to extremes in terms of isolation. We isolate those people with symptoms, and those people are asymptomatic with particular exposure. But if they're asymptomatic and don't have exposure, then I think we can be around those people and just practice the appropriate social distancing. So I think there's a happy balance in there, and I think we need to use common sense in those spaces.
And so, Doctor, a lot of people, when this idea came up about social distancing, kind of, took it as a joke, like, what exactly does that mean? Does it really work?
Yeah, it does work, and I think the biggest reason it works, and not to get gross, but as a clinician, if Dr. Hendricks were to cough right now, any of the droplets that came from his cough, if he didn't cover his mouth, would fall to the floor before they got to me 6 feet away. And so the likelihood of my inhaling some infected droplets from Dr. Hendricks' cough would be greatly reduced, and that's really why this works.
I just want to be clear, I'm not coughing.
No, he's not coughing, perfectly healthy.
Just an example.
Right, but you guys probably do fist bump or elbow bump or whatever is the new norm. And that is the phrase, new norm.
It is.
Flattening the curve. Stay with us. We'll answer more of your questions right after the break. All right, welcome back as we again count coronavirus, your questions answered. So many people have so many questions. We're going to try to get to as many of those as we can, and those questions have come to us through social media.
The place to get the answers from the experts here. So here's the question that we have. If infected, do children recover faster than adults? And Dr. Hendricks, if you will address that, especially in light of the new report today that says maybe these millennials, as they're calling them, in Italy and France are sicker than we first thought they would be.
There's a lot that's unknown about this virus. I mean, we're getting reports from different countries. Initially, there was the percentage of children that were getting infected with coronavirus was less than 10%, 1%. So, but we are seeing children die from coronavirus. We are seeing millennials die from coronavirus. And I don't mean to scare people, but recognize that if you are a young adult, you are not completely in the clear. You can still get the virus, you can still get sick. Our primary concern, just like flu season, are with those medically fragile members of our society. Older people, people with medical conditions, younger children that may have asthma or other medical conditions that would put them at risk. So everybody is at risk of this, and we all have to take it seriously.
Another question, parents with kids home from school are trying to find ways to keep busy. How long can coronavirus live on, let's say, if they go outside and play on the playground equipment? Any of you have an idea in terms of what the early testing is saying about the virus, isn't it, shelf life?
Well, there was a report that came out of New England Journal of Medicine just yesterday, I believe. I was reading it this morning. It was, again, looking at how long the virus can survive on surfaces. Now, this is in a lab type of situation. We're talking 3 days on stainless steel or plastic, 24 hours on cardboard, and maybe 30 minutes in a room when somebody coughs. But this is in a laboratory. We don't know if those viruses at 3 days are still viable. Are they able to cause an infection even though they may still be alive? So there's a lot of variables there. Humidity, temperature, you know, I'm hoping maybe a hot Florida sun would cook it off the playground equipment, but you cannot guarantee that. So my word of advice for everybody that's worried about surfaces being contaminated with the virus that can stay there for a while, wash your hands. It's very easy. So if you're get a package on your doorstep, bring it in, wipe it down with a wipe, and then wash your hands. If you go to the grocery store, you come home, wash your hands. You know, wash your hands in the grocery store before you leave. Use the hand sanitizer. If your kids are out playing in the park, of course you want to limit their contact with other children. Again, that social distancing is hard for kids, but when they're done, make sure you use the hand sanitizer or just have them go use good old soap and water.
And Dr. Hendricks, a lot of people have asked about this. Can people who have already been infected by COVID-19 be infected again?
Well, we're hoping and we anticipate that after an exposure and an infection with this specific virus that you'll develop a degree of immunity to it. So it's unlikely, but like with the flu, I've seen people get the flu twice in 1 year. You develop immunity after that first interaction with the virus, that first infection, and you're presumed to be immune from it, but it's not 100%. So we still recommend people to exercise caution after they've had the infection. They're not in the clear completely.
You know, I think we all understand that the most vulnerable are many times the people with compromised immune systems and the elderly, but what about pregnant women, Dr. Hendricks? What is the early research saying about them passing it along to their baby, or if it's a real problem if somebody isn't ready to deliver a child and is with baby right now?
Well, I think that right now we just don't have enough information. You know, this virus has only been out for a few months, so trying to get information on how the virus interacts with the developing fetus, we believe it would be just like the flu. There's not an increased risk necessarily. We do have one report out of China that came out a couple of months ago that there was a child born with coronavirus, but they're not sure if it acquired coronavirus after birth or during development in the womb from the mother that had the virus. So there's a lot of unknowns, but I just reassure everybody that, you know, the goal is if you're at risk, you want to make sure you you know, keep your distance from people, and you just practice healthy hand washing and all those other practices we keep talking about tonight.
You know, it's interesting, Dr. Hendricks talked about China. Back-to-back days now, they've just had one reported case of the coronavirus, so maybe we can learn from lessons that we're seeing there in China.
All right, still a lot of unknowns out there, but we have the experts here to answer questions about what we know so far, so keep those questions coming. Again, we'll get to as many of them as possible. Stay with us, we'll answer more of your questions right after this break.
You're watching an Eyewitness News special, Coronavirus Pandemic. Your questions answered.
And welcome back to our Eyewitness News special. We have another half hour to go, and we are trying to get as many questions in as we can on our Facebook page. We are turning those questions around. We're trying to kind of group them so that we get the most topics covered.
All right, so let's get right to our expert panel and one of those questions that came in. Should I work from home? We'll start with Dr. Shuck on that one. I guess it would kind of be like, what does your employer say? But what advice for people with that issue?
Yeah, that's great. I'm not going to make the decision for every employer in our area, you're right, but I do think it's wise for employers to consider and employees to consider working from home when the opportunity avails itself. We actually, in our own company, are encouraging those non-essential members of our staff that are not directly involved in patient care to work from home where possible, and encouraging them to do so. We already began that about a week ago, and we would recommend similar practices or policies for other folks.
All right, so I'm a business owner or a manager. Is it safe for my employees to come to work?
Yeah, again, I think that goes back to it's safe for them to come to work, but if there is no ability to social distance yourself at work, if there are shared surfaces at work that aren't frequently cleaned or wiped down, those kinds of things can contribute to the spread of a virus if someone is sick at work. So we want to make sure that we're trying to minimize exposure, and working from home allows folks to control that environment and do that to a greater extent.
And so
it's not unsafe to go to work.
Okay. All right, so how about this question? Should I travel on a business trip?
Yeah, again, I think that's going to be an individual company's decision. I can share with you that we have limited travel, business travel. All non-essential international travel has been canceled and forbidden, and all domestic travel is on a case-by-case basis, and recommending not using mass transit to travel. So we're doing everything we can as an organization to practice what we preach in terms of prevention and minimizing exposure. In addition, we've done things like cancel all significant in-person meetings over 20 individuals. We're moving all of our meeting structures to virtual meeting platforms where possible, and canceling all non-essential gatherings.
Of course, the federal government, various companies have an impact here, but we don't know if, it's going to be cruise industry, business as usual soon. We talked about the flights, the vacations that people have planned. What's the recommendation from the hospital in terms of, moving forward with some sense of normalcy with family vacations?
Yeah, I think we're gonna not be able to move forward with a sense of normalcy for a number of weeks yet. I think we're just now beginning the presence of the virus in our community and seeing community spread, and I think normal's going to be a few weeks away. I would caution everybody against non-essential, non-urgent travel at this time. No question about it. I think those are individual decisions, but there are some considerations that people should understand as they're considering travel plans for personal reasons. You could find yourself in a country outside of the United States and find yourself in a quarantine in a country where you may or may not speak the language, and whose healthcare system you're unfamiliar with, and you would want to potentially avoid that. In addition, if you travel internationally, you're putting yourself immediately at risk for someone who needs to self-quarantine upon return, and at risk for those around you to potentially spread the virus if you had the virus. So again, I think it's really more of a common sense approach and understanding what's at stake when you make those individual decisions.
All right. Our radio partners at News 96.5 WDBO are also taking your questions. So let's check in with Joe Kelly to hear what some of the radio listeners there are asking about this. Joe?
And Vanessa, I'd like to point out that I'm also in my own studio here, keeping that distance away from everybody else. In fact, we're told 6 feet. We're actually a little more than 6 miles away from you. So we've got a good distance here that we're maintaining tonight.
We're all good.
We heard from Samuel in Orlando. And he asks, are there any medications that could make the conditions worse?
That's a good question. Dr. Hendricks, if you could weigh in on that. People who are taking medications for various things like maybe diabetes or high blood pressure.
Well, that's very interesting because the World Health Organization just came out with a statement about there's a little bit of a concern of some people having a reaction to ibuprofen or Motrin when they have the virus. Now, they're early information, so we may have to adjust our recommendation because if you have coronavirus and you're going to have a fever, most people that get coronavirus will have limited symptoms. There'll be fever, cough. It'll run its course in a week or so, just like the flu. That's 80 to 90% of people are going to be able to self-care at home. So we need to know what's the best thing to use. You want to use Tylenol, for instance, to keep the fever down. But in terms of your medications, prescription medication medications are not the problem. It's the underlying condition like diabetes and heart disease that puts you at higher risk of complications. So when you're self-caring at home, and we will start recommending when people get the virus that if they're okay, we don't put them in the hospital. You stay at home like you do with the flu. You drink plenty of fluids. You take Tylenol to reduce the fever, tissues to cough into, and you get your rest, and eventually that will pass.
We had a listener who texted us and asked, when do we get back to the sense of normalcy? When do things return to the good old days, the boring old days from, say, a week ago? When do we finally get on the other side of that curve?
I hate to say it, but I wish I had a crystal ball on that one. We just don't know. There's a lot of variables on this, but you've got to realize that this is an outbreak. It'll get worse, and then it'll get better. How long that takes, we don't know, but we're trying to limit the spread. You know, a good word that we in Florida are very familiar with, we need to hunker down and ride this thing out and be ready to stay at home and try to self-isolate, keep away from people, and listen to your public health authorities on following those guidelines, because fewer people that get sick, the less people are going to be in the hospital, and the less overwhelmed our systems will be. So we have that social responsibility to stay home and take this thing seriously, because we are on the cusp of an outbreak, and probably in the next few weeks we're going to see more and more cases coming in Florida. So we need to be ready for that, and our hospital systems are ready for it. We've been planning for several weeks now, night and day, getting ready for putting up tents in front of our ERs. You've probably seen those going up around town. That's not to alarm people. That's just our drilling and getting ready for diverting those people that come in, because when they all come in sick, you know, we've got to be able to sort them out and get them the care they need.
All right, and I wanted to ask
that we have to have, and you know, will there be enough beds? Will there be enough, you know, places for people to get the care? And it sounds like Dr. Hendricks and the team are certainly planning for that.
I wanted to ask Dr. Allen also, based on what Dr. Hendricks has said, when we hear that about possibly seeing tents and getting prepared, how do we mentally kind of guard ourselves and prepare ourselves for that? Because that can be a scary sight if we drive by the hospital and see tents there.
It's one of the aspects that's in behavioral health that sometimes we provide is anticipatory guidance. So if we know that what is going to happen, it's very important, rather than viewing it as an entire mountain, to make little molehills out of it. So by having that type of information, by us knowing that this potentially could happen, the anticipatory guidance helps to decrease some of that level of anxiety that we can experience during these times.
Excellent. You know, we're taking those questions still. We still have another 25 minutes or so. Also, you hear some noise maybe in the background of our doctors, and that's because that's where the call center is. The number is 1-877-VIRUS-HQ, 1-877-VIRUS-HQ, and this also is your opportunity to ask more questions.
And you can hear in the background the other people are really asking questions there, and they have a panel of medical experts there to answer your questions as well.
All right, stay with us. We'll answer more of your questions coming in on social media right after the break. Welcome back. We do have some breaking news as it relates to the coronavirus pandemic that's going on, and this just came in. President Donald Trump has signed the coronavirus relief package. Now, this bill includes help with unemployment, paid family leave, more funding for SNAP programs, you know, food assistance, and free COVID-19 testing. We'll have much more on this on WFTV.com, our social media pages, and of course on Eyewitness News Tonight. But again, this is an ever-changing story, and
Absolutely.
so that breaking news just crossed.
And that was one of the questions that someone asked earlier about free testing, not being able to afford it. So that's important news for people.
And we are live here tonight, just so you know.
All right. Here's another question from someone asking, can the virus, COVID-19, be spread through food? Dr. Hendricks, that's an important question because so many people around here like to eat out, and there's some fear about that now. Can it be spread through food? Do we even know?
It's really unlikely. I mean, this type of virus, as we know of other coronaviruses that are out there that cause the common cold, the heating process and cooking process should kill off the virus. Safe food handling practices in a kitchen will prevent the spread of most viruses and infections like norovirus and other infections, salmonella we hear. So all those practices should protect your food. Now, I've been asked about, like, well, what about like if you go to the grocery store and and you buy fruits and vegetables. Of course, your standard operating procedure when you get home should be to wash off your fruits and vegetables. You should be doing that anyways. The water, a little bit of soap, and scrub them up, and that should eliminate any virus, and wash your hands after you shop. But getting an infection from just eating contaminated food is really unlikely. Now, when we that may sound a little bit contradictory, because some of this started with contact with wild animals in China, in Wuhan, China, and these markets where they eat and consume these types of animals. But these are like bats and some of the specific animals that are carriers of the virus, but nothing you're going to encounter here in the United States.
Just as a follow-up to that, another viewer and Facebook follower asked this question just moments ago. Can the virus, doctor, be spread through drinking water, pools, or hot tubs?
No, again, these are locations, for instance, the chlorination in a pool or a hot tub, that the virus is not going to be able to survive very long at all. Drinking water, again, is chlorinated and it's treated, so there should not be any transmission through those types of mechanisms.
All right, we're going to continue on with our discussion here. I do want to go back to the young people and some of the video that we have shown in the last couple of days of the proximity of young people. And if anyone on the panel, Dr. Shook, I think this would be good for you to note. Early on, again, information and misinformation are two different categories. Some of the early misinformation was that young people, millennials, likely we're not going to be as susceptible to the coronavirus, and yet we're seeing over and over again, and now in Italy today, reports of people being very sick in that young age group.
Yeah, and again, I think it just goes to, there's a lot about the virus that we don't know. And I think it's important to point out that while there are many people that get very sick, and we hear about that a lot on the news, and it's very concerning, the vast majority of people that get this virus will have mild to moderate symptoms and not require hospitalization or significant medical care. Only a small fraction of folks will get that sick. And again, I think it's very hard to predict demographically which group is going to be most affected. Certainly those that are immunocompromised, those who have chronic illness, those that are older that tend to be immunocompromised, tend to be those that are more significantly affected. But there have been seriously ill individuals of all demographic age, and there's just a lot we don't know about the virus. So I think the same precautions that Dr. Hendricks talking about apply to all demographics, all age groups.
All right, that was a big issue, the fact that people who could spread it to other people, they might not, look sick or feel sick, but the whole point is if they're spreading it to other people, that's very dangerous. That's the issue.
Absolutely.
One of the many issues. Stay with us. We'll answer more of your questions right after the break.
Welcome back. Lots of questions coming in. Some folks are actually tweeting me, and I'll get those questions turned around for you to have answered in this next segment.
Okay, here's a question I want Dr. Hendricks to address here. We know that in Seattle this week, we had some people who were the test case for the vaccine. So how long until we know if that vaccine is effective?
Production of a vaccine takes months, so it's exciting that they're getting out of the gate and getting testing started on human beings. Personally, I would volunteer for that. This is an important factor and an important impact on our society in general. But unfortunately, it does take several stages to go through that testing and production. If you remember H1N1, when that first came out, we did not have a vaccine for H1N1. It took several months before we developed it, and everybody's clamoring to get their H1N1 vaccine. But it did take a while. But that was going from a flu vaccine to another type of flu vaccine. This is something new, so it might take a little bit of time, and it's exciting, but I wouldn't get our hopes up.
We heard Governor DeSantis talking about Schwabs and things like that were needed. What is the time frame on people being able to readily get those tests, and how quickly can those swabs turn something around? How soon after contracting COVID-19 is the actual specific question. Will someone test positive? If they just bump into somebody today and get tested later today, could that come back as a positive test?
That's a good point. If you're asymptomatic, meaning you don't have any symptoms, the test is going to be negative. It's very rare for those tests to come back positive in somebody that is not having symptoms. So that's why if you bump into somebody, or actually it's not just bumping into somebody in your home or somebody you're having close contact with has the COVID-19 virus, it's going to take up to 5 days on average to develop symptoms, and at the longest at 14 days, earliest to 2 2 days. So if you develop those symptoms, then we would test. But before that, it's just not going to tell you whether you had the virus. And once it's widespread in our community, you test today and you're like, hey, great, and then next week you run into somebody else that has it, then it's all about, you've got to keep your guard up continuously. I talk about, you talk about the millennials and younger people that just aren't taking this seriously. It's all about that distancing, and I like to use the word air gapping, maybe talking the lingo of computers, air gapping between. You have to have that distance between people, because that will stop the spread of the virus. This is our opportunity. Now, we know it's coming by our firm actions, the closing of schools, the closing of businesses. These things all seem very severe and very draconian, for lack of a better word. But this is the way we're going to stop the spread and slow the spread in our community. And so we all have to take it very seriously right now.
All right, and the next question, Dr. Hendricks, if I contract COVID-19 and recover, can I expect any long-term effects? Is that one of those we're just going to have to wait and see, or is there anything we can tell right now?
Well, for most people that have the coronavirus, that get COVID-19, like I said, 80 to 90% we have evidence have mild symptoms. Let me rephrase that. They have a miserable infection, but they're not going to be in the hospital. It's like having the flu. And every time I see people with the flu, they're like, I never want to have that again. This is what it's going to be like: high fever, chills, and cough, but you can weather the storm at home without having to go to the hospital. Those few people that end up in the hospital, that end up with pulmonary infection, lung infection, there could be some damage that occurs over the long term. But again, this is real early in our knowledge of the virus and how it acts. And we do know that somebody has a severe infection could have some persisting damage to the lung. But again, these are people that are in the hospital that are having to be intubated and put on ventilators.
All right, we've got more questions coming in, including my question I want to have answered. Is this going to be a permanent way of life? Stay with us. We'll answer more of your questions after the break. I know we've kind of danced around this today and people are concerned about it. I want to ask Dr. Shuck something that maybe I can get just a quick answer. Is being fearful of germs and touching people and touching doors and all the things we're worried about now, is that our new normal even beyond coronavirus?
Yeah, I would say a couple of things. I would probably take issue with the word fearful and more use the word cautious. I do think that being cautious of germs and the transmissions of germs from one person to another, I don't think it should be a new normal. I think it should have been our normal to some degree. The things that Dr. Hendricks and I are talking about in terms of hand washing, keeping social distancing when people are symptomatic with cough, isolating yourself and not going to work when you're sick, those things apply as much to influenza and a cold as they do the COVID-19 virus. So I do think it is an opportunity for us to reinvigorate our understanding of what it takes to help prevent the spread of infection like this. And I would say for a while, we're going to be really well educated in that process over the next few weeks to months. And hopefully that will stick with us and be applicable to the next year's flu season as well.
Another question we have someone reached out on social media. Should I be concerned about getting change from a purchase touching dollars and coins? Dr. Hendricks?
Oh yeah, I'll take that one.
Yeah.
Oh no. All right, I got a great one here. The phone, your handheld device is a wonderful thing. I go through my coffee drive-through every day and money or cards, and this morning I stopped in the parking lot and I downloaded the app. Finally, and now I can just scan. I don't have to touch and handle money. I don't have to put that person at risk that's taking my card, my credit card. So things like that. We live in an amazing age where we can now connect over the phone. We can download an app so we can do video chats with a doctor. E-care is what we have at our system, where you can download and talk to a doctor or nurse practitioner, get advice without having to go out in the public and have that type of transmission. So the technology we have there is great to help support us during this time. This is a once-in-a-lifetime event. This is unprecedented in my career. I've never seen anything like this. I mean, we've been through Ebola, we've been through H1N1, we've been through hurricanes. I've talked on these types of the interviews to try to reassure people we're still here. We're going to get through this, but we need to use all of our tools that we have at our hand.
If I could just add to that, Tim, I think another important point. So we have the technology, but the short answer is yes. We think you could have a virus transmission through those types of modalities because the virus lives on inanimate objects for indeterminate periods of time. But even if it wasn't COVID-19, washing your hands, not touching your face after you handle money, using hand sanitizer, those would be the appropriate things to do in any other setting. They're even more appropriate now, given the COVID-19 virus.
And you know,
I forgot to mention, wash your
this,
hands.
Yeah, the thing to remember with this is nothing is going through your skin, right, doctors? I mean, so whether you touch something, whatever it is, as long as you don't touch your nose, your mouth, rub your eyes, then regardless, you'll be fine. The question popped up. Short answer, yes or no, Dr. Shuck. Public transportation, should I avoid it?
Yeah, I think avoiding public transportation is probably a reasonable thing to do. And again, that goes to social distancing, right? Because if you're in a crowded public transit, there's more likely that you would be in contact with someone to potentially spread germs. I don't think you need to be fearful of it. If you must use public transportation, try and use social distancing. Don't sit down next to somebody if possible. If you need to stand, stand. If you need to pick a seat that's a little further away from somebody on the bus, that's fine to do as well. I know there are people that need public transportation to get around, to get to their employment, et cetera. Just use common sense in terms of social distancing. And again, if you're touching things, make sure you're washing your hands or using some hand sanitizer at your earliest convenience. And please don't touch your face, your mouth, your nose, those kinds of things.
All right, we've got 90 seconds left. I want each of you to answer in like 10 seconds or less. The new normal, will we be better for what we're going through now as a society and Central Florida with just a short period of time, whether it's mentally, physically, will we be better for this? And you can start you, Dr. Shuck.
Okay. Yeah, I think my short answer is yes, and I think there are innumerable reasons why. Some of it is determined by our attitude and our preparation and our messaging through this process, but I certainly think we can learn a lot that will better us moving forward.
Dr. Hendricks?
I'd have to agree. It is difficult to go through these times, but we can prepare. A lot of the plans that we're doing now are from H1N1, from Ebola, so we continue to grow and develop as a society and as a medical system to prepare for these types of things in the new global society we're in.
And briefly there, Dr. Allen, will we be better for this?
And from mental health aspect, I think we are practicing some healthy routines that, as it relates to our sleeping habits, eating healthy, trying to exercise, even though I know we don't have the gyms right
Absolutely.
now, but just
all right,
going
we're
outside.
running out of time there, Dr. Allen. Thank you.
In other words, we're going to be okay when we get through it. Take care.
We'll get through this.